fluid is a thin, transparent fluid that helps the lungs expand and contract smoothly. It is located within the pleural space. The pleural space surrounds the pleural membranes which make up the lungs. It is found between the chest wall and the lung pleural membranes. Pleural fluid is collected through a process called thoracentesis. This can be used as a diagnostic tool or as a therapeutic procedure. The pleural fluid is taken to analyse whether there is any disease or infection present. Even though it is an invasive procedure, it helps diagnose patients and speed up treatment time. Before the procedure, you will have a consultation with your doctor where they will talk you through the process and talk about any risks that are involved. Some of the risks involve bleeding from the puncture site or infection at the puncture site, but these are rare. This consultation will allow you to ask questions and express any worries before the procedure goes ahead. At this consultation, your procedure date may be booked or you will receive a letter with the details. Your doctor will also give you a thorough medical examination to ensure you are fit enough to go through with the procedure. If you do not pass the medical examination, another procedure will be suggested to you. Make sure to tell your doctor if you are pregnant, as there are more risks to pregnant women having the procedure. If you have any drug allergies or are sensitive to any medications, for example iodine or anaesthetic agents. If you are taking any prescription or over-the-counter medication, you will also need to inform your doctor if you are taking any recreational drugs. On the day of the procedure, you will need to wear loose, comfortable clothing. Old clothing is advised as some gels and cleaning agents may stain fabrics. You must take out any piercings or remove any jewellery that may interfere with the procedure, and your vital signs will be checked before the procedure begins. Your blood pressure will be checked. This is done using an automated or manual blood pressure cuff that is placed around your upper arm and inflated. The average blood pressure is around 120/80, but as everybody is different, your doctor will know what your average blood pressure should be, dependent on your own health. The nurse, doctor or clinician will also test for your breathing rate. They will do this by measuring the number of times you breathe in and out in 1 minute. They will measure from the front and the back of the body. The normal breathing rate for an adult is 8 to 10 breaths per minute. But again, this will depend upon your own health and background. Pulse oximetry is used to measure the oxygen saturation level. This means what percentage of oxygen you have in your blood. The device is placed on your finger or ear and it is completely pain-free. A pulse oximeter may also measure your heart rate, and you may be asked to wear one on your finger throughout the procedure so that your heart rate can be monitored. Before the procedure, you will have an ultrasound conducted. This will be done so the doctor can identify how much fluid is present in the pleura. They do this by placing lubricating gel onto your skin and using a small handheld device called a transducer. The gel allows the transducer to move smoothly, ensuring there is continuous contact between the sensor and the skin. The transducer is connected to a computer and a monitor, where the images of the fluid will be shown and the clinician or the doctor can assess how much fluid is present. At the start of the procedure, you will be asked to sit in an upright position with your arms raised, leaning over a small table with a cushion. This is to ensure your back is in the correct position by spreading out the space between the ribs for the needle to be inserted. If you are unable to sit, however, you can lie down on a bed, lying on your unaffected side. You will be asked to remain still during the procedure by ensuring you don't cough, breathe in deeply or move. The skin around the puncture site will be cleansed beforehand with an antiseptic solution, followed by local anaesthetic at the site. The needle is then inserted. You may feel a small amount of discomfort during the process, however this will only last around 10 minutes until all the fluid is collected. If there is a lot of pleural fluid being analysed, tubing may be required to drain the fluid into a bottle before analysis. After the procedure is complete, some bruising may occur at the puncture site. However, a dressing will be placed on the site which should be worn for a few days until the swelling has gone. After the procedure has taken place, there are many things the doctor or clinician will do before you are allowed to go home. Your vital signs will be monitored to ensure that you are well enough to be discharged. If you are not well enough, you may be kept in a little longer. You may have to have a chest X-ray. This will be to ensure all of the fluid has been removed. If all of the fluid hasn't been removed, you may have to undergo the procedure again, or you may have to make another appointment to come back. After you have recovered, you may return to your day-to-day activities, but do not put too much strain on the puncture site, as this could cause complications. You must notify your doctor immediately if you have any difficulty breathing, you are bleeding more than usual, or there is any unusual discharge from the site. This could be signs of infection that has got in through the puncture site. The fluid collected during the procedure will be analysed for various infection and cancer. The analysis will take place in the laboratory, and the results should be available 7 days after the procedure. You'll be able to contact your doctor to receive your results.